mode of mechanical ventilation. Modes of mechanical ventilation is patient ventilator dynamics, phase variables, and lung protection. Objective 1, patient interaction. Understood how the mechanical ventilation ventilator sense, synchronize, and interact with the patient respiratory drive and effort. Basic modes, master of fundamental modes of mechanical ventilation, volume control mode, pressure control, spontaneous modalities, and third object, setting adjustment. Learn precise parameter, adjust the strategy to optimize alveolar ventilator and prevent ventilator-induced lung injury. Patient ventilation interaction. Neuromuscular axis, ability to breathe, and the metabolic axis is the demand to breathe. Ability to breathe, central drive, muscle strength, thoracic mechanics. Central drive, brainstem signal, and phrenic nerve impulse transmission. Muscle strength, the diaphragmatic tone, intercostal muscle power, and fatigue resistance. Thoracic mechanics, chest wall compliance, and elastic recoil of the lung. Demand to breathe. There is chemical stimuli, metabolic rate, and clinical goal. Clinical stimuli, according to arterial PCO2 and pH and central chemotherapy feedback. Metabolic rate, systemic oxygen consumption, and carbon dioxide production. Clinical goal, match ventilator assistant precisely to the patient work of breathing. The ventilator pneumatic circuit, the gas flow inspiratory valve open and deliver the air to the lung, and then close the inspiratory valve and open expiratory valve. Breathe phases variables. There is trigger. The trigger inspiration start signal the ventilator to initiate the breath. Time and pressure and flow. Triggers. Limit inspiration control. This flow or pressure during the gas delivery without terminating the breath. Cycle expiration transition. Terminate inspiration and open expiratory valve based on the time, volume, flow. Breathe trigger mechanism. There is machine trigger and two patient trigger. Machine trigger is the time trigger, breath delivery initiated automatically by the ventilator microprocessor based on the preset respiratory rate. Patient trigger, there is pressure trigger or flow trigger. Pressure trigger, this initiate when the patient inspiratory effort generates negative pressure drop below the PEEP. Here, flow trigger, initiate when the patient inspiratory effort divert preset flow rate from the continuous circuit bias flow most sensitive and comfortable. Time trigger or cycle time, this according cycle time, this means 60 minutes on over respiratory rate. For example, the patient set respiratory rate 15 beats per minute. 60 over 15, it means 4 seconds. 4 seconds per cycle. For this diagram, if you need 30 beats per minute, this 2 second cycle. 20 beats per minute, 3 second cycle. 15 beats per minute, 4 second cycle. 10 beats per minute, 10 breaths per minute, this 6 second cycle. 6 breaths per minute, 10 second cycle. And then pressure trigger sensitivity. If the patient have decrease by -2, like from you are set the B5 and decrease 2, it means become B3 now, the patient will try to trigger to take inspiration. Flow trigger, here 5 liter, out 5 liter. If decrease 2 liter, less than initiation 5 liter, the patient try to deliver gas to the patient. Limit control modalities. There is volume target and the pressure target. In the volume control mode, like this, the ventilator deliver fixed, preset, tidal volume and flow rate during the inspiration. Here the constant, the tidal volume and inspiratory flow. Variable airway pressure variable according to lung compliance and airway resistance. The pressure control mode, the ventilator maintains a fixed peak pressure target throughout the inspiration. Constant here, peak airway pressure. Variable deliver tidal volume and flow vary based on the lung compliance. Volume control mechanics. Core relationship, the volume and the flow and the time formula. Tidal volume here, deliver is directly determined by the product inspiratory flow rate and inspiratory time. Here, volume, flow rate, and inspiratory time. For example, if you need to deliver 500 cc in 1 second. In 1 second, you need to set the flow 3 liters per minute. If you need to deliver this 500 cc in half of your time you are set like 1 second, but you need in the half of this 1 second to deliver 500 cc. Increase the flow to 60 liters per minute. Equation of motion for volume control. Here, total pressure resistant multiply flow plus volume over compliance. There's a fixed variable here, volume at the tidal volume and the flow rate are logged by ventilator setting. The pathophysiological effect, if the lung compliance decrease in the ARDS and pulmonary edema, here total airway pressure, okay, must be increased to maintain the constant target tidal volume. High risk for barotrauma if the peak pressure exceeds the safe physiological limit. Equation of motion and pressure control. Equation of motion pressure control, constant pressure mode. Constant and resistant multiply flow volume over compliance. Fixed variable here, airway pressure. Pressure total is strictly clamped by ventilator. Pathophysiological effect. If the lung compliance decrease, stiff lung for example, deliver tidal volume must be decreased to keep the peak pressure constant. In this time, the patient high risk for alveolar hyperventilation and hypercapnia if unmonitored. Inspiration cycle mode. Machine cycle or patient cycle. Machine cycle by the time inspiration terminate and exhalation open strictly when the preset inspiratory time elapses. Standard for mandatory control breathes in the volume control and the pressure control modes. Patient cycle, flow cycled, inspiration terminate when the inspiratory flow reaches a preset percentage peak flow, default baseline 25%. This in the mode of pressure support ventilation. You can set like this in the pressure support ventilation only. Classification of breath types. You have breath type mandatory, assist breath, spontaneous breath. In the mandatory, you have comparison between trigger and limit variable and cycle. When you start ventilation, trigger here by machine, mandatory. Limit here by machine, volume or pressure. Cycle here by machine, time or volume. In assist breath, the trigger, patient can start initiate the breath, pressure or flow. Limit still by machine, volume and pressure. Cycle still by machine, time and volume. Spontaneous, trigger by patient, pressure or flow. Limit, patient, machine. Support, patient, flow, cycled. This is the diagram or this flow chart or curves in the mechanical ventilation. There's a pressure to time, there's a flow to time, there's a volume to time. Lung protective ventilation. Lung protective ventilation. To prevent induced lung injury, pathophysiology, volumetrauma, overdistension due to excessive regional tidal volume, barotrauma, high transpulmonary pressure causing air leak or pneumothorax, atelectotrauma, cycling, opening and collapse of unstable alveoli, pyotrauma, systemic inflammatory cascade driven by biophysiological damage. Protective setting, tidal volume from 4 to 8 mm per predicted body weight, plateau pressure less than 22 to 30, driving pressure less than 15. This patient driving and the plateau pressure, high driving pressure more than 15, lower the tidal volume or consider prone position to improve the lung strain. High plateau pressure in obese patient, chest wall stiffness rises without excessive alveolar transpulmonary pressure. If the excessive patient effort, consider sedation and neuromuscular blockage to prevent patient self-inflating lung injury. Thank you.